Are you finding yourself reaching for your painkillers daily because you think they're safe? Maybe it's time to look at that equation again. Let's compare medical marijuana to just over-the-counter medicines. Ibuprofen or other NSAIDs, naproxen, Mobic, Aleve, those kinds of medicines. NSAIDs are one category. They're anti-inflammatory drugs, so that's how they work to kill pain. The other category over-the-counter is going to be your Tylenol base. Well, what we know about traditional medicine is if you take too much, we know how it can harm you. So let's start with Tylenol. Tylenol is metabolized by the liver. We know for sure there's a maximum you can take on a day safely. We also know for sure that every year in this country, someone overdoses on Tylenol inadvertently because they just have symptoms of their flu or cold bad enough they keep taking it and their symptoms aren't going away and they keep taking it. So Tylenol overdose can kill you in 24 hours, even a college kid that's otherwise healthy. Wow. That's a statistic. We're saying 4 grams a day. Now we're saying maybe 3 grams a day. So our little over-the-counter has gotten quite dangerous. Now, what else is metabolized by the liver? Alcohol. So you have the two together, you have some serious long-term health risks. Now, let's look at the other. The NSAIDs, the non-steroidal anti-inflammatory drugs that I listed before, the painkillers. Those are all metabolized by your kidneys, the only other way to get them out of your system. And it's really hard on your kidneys, affects your kidney function, but it affects it silently. So if you're not getting blood tests, you don't know over the years. What most people notice about anti-inflammatories when they're having trouble with them is the burning in your stomach, the irritation, the gastritis, or can cause ulcers or can cause bleeding complications, especially for patients on other meds. So you think of these over-the-counter medicines safe, but they're only safe in moderation and they're not safe unlimited over the years. Cannabis has not been studied the same because it's just becoming legal over our lifetimes. But we have large retrospective aggregate data. And what we're seeing with cannabis use, daily long-term use, is that when your symptoms are better, you're able to come off these other medications, thereby getting your kidney function better, getting your liver function better. And the other thing is most patients that are happy with their cannabis start coming off pharmaceuticals like these over-the-counters. They're prescriptions, but it's amazing how many patients don't use as much alcohol either because their symptoms are better and they're treating the problem. So ultimately, the net effect is you're really improving your health. And again, once you're feeling better, your symptoms are under better control, you can take better care of yourself, eat right, exercise, sleep better, recharge your batteries, and live your life to the fullest.